Welcome, everyone. It is Monday Motivation with Dr. Serena Chen and Alice Crisci. We're talking about an important topic today, and that is timing of pregnancy given the COVID virus. There's been a lot of conversation within the infertility community itself about canceling, delaying IVF treatments, but now there's a whole nother aspect of that conversation that includes people who are delaying weddings, honeymoons, and so forth. And now they're asking the question, should they proceed with trying to conceive unassisted in a different order than the order they expected? Should they do embryo freezing? Can they even access embryo freezing services? So Serena, let's start kind of at the tippy top of this conversation, which is what are the ASRM guidelines in terms of pregnancy timing and infertility treatments?
I'm just trying to get rid of all that glare. I don't know why I have so much glare. But,
there's no glare with us.
Okay, so right now ASRM is essentially going along with a lot of the federal guidelines of like trying to do physical distancing, or otherwise known as social distancing. Although physical distancing I think is more accurate because we want people to be social because that's good for you. But we want it to be virtual socialization, and then, trying to wash your hands, don't touch your face, trying to be safe. Yeah. And it does seem like social distancing does make a difference in terms of spread because there does appear to be asymptomatic spread. So that means you're just walking around with the virus and you're spreading it because you feel fine, and it's causing a lot of issues. So. ASRM guidelines has said to stop doing fertility treatment, stop seeing people in the office. A lot of doctors and dentists and veterinarians, they're all trying to stop in-person visits because we're just trying to stay at home and separate from each other as much as we can. So they did say for super urgent situations where like you're about to get chemotherapy and chemotherapy kills all your eggs really quickly, that we are still doing that kind of fertility preservation, but fertility preservation that goes a little bit more slowly, like for age, they are not recommending to do that right now. So
so anyone who is already interested in egg freezing for whatever reason that's unrelated to an urgent or emergent medical condition, they're recommending that you don't proceed with treatment right now.
Yeah, and it's a little bit crazy because, like a lot of cancer patients that need surgery, at least in New York and New Jersey, they're delaying cancer surgeries. Even.
I can't, look, as a cancer survivor, I can't even imagine. I cannot imagine both the immunocompromised situation with people who have already, not thousands, millions of people who have already been undergoing chemotherapy treatments. And then adding in that second layer of, unless this surgery is life or death surgery, we're holding off. Right. And the anxiety level of having a tumor still in your body is incredibly high.
There's multiple layers there, right? There's like the layer of if you're doing a surgery and you're not about to die right now, then you are using like a room and a ventilator that someone who might die right now from COVID could possibly use. We don't have enough ventilators. Then there's the idea if you have cancer, you're immunocompromised, and then you in a situation where there's more exposure. So the hospital, there's more. I mean, I think you have to behave as if the virus is everywhere, but we definitely think the viral load, the amount of virus at a hospital is definitely higher. So exposing yourself to the hospital and to the OR and to the staff, all of whom have a lot more exposure than your average bear, is probably not a great idea either. So there's multiple levels. Like I don't think anybody is saying that it's not important, which is like a difficult part of the ASRM guidelines. As you know, they were really controversial. A lot of people got very upset by them. And there's this balance between, obviously, infertility has in many ways been treated by our society with a lot of shame and stigma and secrecy.
It's been treated as an elective procedure for many, many years, and advocates have fought very hard to be recognized as the disease it is and to not be treated as an elective procedure.
Right.
So I
then
think
the ASRM guidelines kind of gave that vibe. I think they did clarify. They didn't say it was elective, but it did seem like to a lot of infertility patients that it was insensitive of that fact, of that struggle, of that mindset, which I don't.
And providers. I mean, I've heard the same from a lot of the providers in our network, that they felt the same, that it was. And look, language is really powerful, right?
Yeah.
How we say things then creates a story that they either interpret the way that you wanted them to interpret it, or they interpret it a totally different way. And I think what we're striving for is to come together as a community. And I think using the oncology cases as an example, which is we're saying, like, look, if this is a delay of 8 weeks is not the difference between ever having a child and never having a child. Likewise with cancer, if this particular surgery is not the difference between your life expectancy and not, and dying imminently.
Right.
That's really where the health system is, because of the lack of ventilators. Yeah. I mean, first and foremost, it really does boil down to not just the viral load, but we really do have a lack of equipment in this country.
Yeah, we do.
So
we're not set up to handle like this crazy pandemic. But the idea is, it does seem like if we are really aggressive about shutting down and doing as much shutdown as possible,
right,
theoretically, we would still have people getting sick, but just not so many people getting sick all at once that the whole healthcare system is overwhelmed.
And that, I think that's such a key too, is that if you look at the places like New York that have such an extreme number of cases compared to some of the other cities, some of the other parts of the country, how we handle kind of the shutdown or the social distancing or the stay-at-home orders in these areas is so incredibly critical. And if there's anything that we can do to support the slowdown of this pandemic, we have to do it.
Yeah.
I have a question for you, though. Can egg retrievals be done without anesthesia?
I'm sure they can. I think my understanding is that's really common in Japan, but it's not very common in the United States. And a lot of infertility patients are, it's high risk if somebody moves a little bit, because it's a little tiny needle in a very delicate area, and there are a lot of big blood vessels nearby. So, and I think, you don't know how you're going to react. And we really want people, like I really want people to be totally asleep. I think there are some places that maybe, especially the minimal stim places, maybe do it without anesthesia because they're only just getting one follicle, not like a dozen follicles.
Right. But that's important. And that's important for patients to understand it, because they're asking, like, well, why can't I do it anyway? Or why can't I do it this way? I mean, we have to weigh the risks and benefits of everything, right? And if you then puncture an ovary because someone had an unexpected pain or discomfort and they just jumped that much,
could make it riskier. Yeah.
Then you might end up with somebody in the ER, which is already overtaxed with COVID cases.
Yeah.
It's a spiraling impact. I think likewise, this, similar scenario of people that if there's a complication, an ectopic pregnancy, if there's
that's why we're nervous about people getting pregnant. And I know that was another thing that was really controversial, is that we didn't say all people should stop getting pregnant. And yet ASRM was telling their patients who are suffering from infertility not to get pregnant. But there's a couple things. Number one, I personally, even if you're healthy and you don't have infertility, I think it's really scary to be a pregnant lady right now. Because like, what if you get sick and then the hospital's full of COVID and you have to deliver your baby and there's not enough beds because they're full of COVID-19 patients. It's not an easy time to have to need any medical care at all. So not just infertility patients, but infertility patients in particular tend to have higher risk pregnancies, much higher rates of ectopic pregnancy, which can be deadly, much higher rates of miscarriage, just much higher rates of complicated pregnancies. So you know, I would be kind of nervous for anybody, whether they were infertile or not, to be pregnant right now and needing medical services right now. I would be nervous about that.
I know, and that's a disappointment to a lot of people, right?
Yeah,
it's just to say, like, this is not fear mongering. This is really just looking at the volume of patients under care for COVID in some of these, you know, denser populated areas like New York, New Jersey area, like LA.
This type of social distancing does work. Like we are seeing that you can decrease the number of cases, you can decrease the strain on the healthcare system. And, you know, Dr. Fauci's been saying it, and we've been looking at the data from Wuhan saying that it does see, it's like 4 to 8 weeks of pain. And then, you know,
then the world comes back up again, and we can like live life as normal. Now, if we consider that with fertility, I want to get to the hopeful part. There's so much that you can do in a 4 to 8 week period to prepare even for an unassisted attempt, right? I mean, look, 2 months, you get 2 tries, right? I mean, you can have lots of tries, but you know, you have only 2 ovulation attempts if you're approaching this as at an unassisted, you know, standpoint. Perfect timing to really track your health stats, right? Get a really good ovulation kit. If you have PCOS, use a clinically validated one like from OvuSense, so that you can at least get sort of the sense of agency or the feeling of agency, like you know your data, you know exactly when you're ovulating.
Prenatal vitamins lower the risk for neural tube defects. It's a type of brain defect, but to get the maximum effect, you want to start at least 2 to 4 weeks before you conceive. You know, I think there's a lot of stuff. You know, it's good. Like, let's quit smoking now. Let's do a little healthy weight loss. I think those things will just set the table for a healthier pregnancy.
Right. I think now would be a very difficult time for people who have addictions that are like coping mechanisms to try to quit right now. I just want to throw that out there. I think it
probably is something, but at the same time,
when
you're doing your research online and you know, like that might be a reasonable time to think.
No, definitely. I get that. I know. Like at any point it is, you know, doing healthy habits, you know, taking on the things that you know you need to do anyway. And you don't have maybe like the additional pressures of life. We have very bizarre pressures that we've, you know, very bizarre stress, right? That we've never been faced with before. Not having the capability of having, you know, just the social interaction. Like my team was talking this morning about how much we miss hugs. You know,
that's hard. That's really hard.
It's a really hard one for me. And my groomer came to the house today to take care of my dog. And I was like, do you feel okay if we hug? Because we always hug. She was like, I'm hugging. And I'm like, all right, I'm going in. You know, wash my hands after, but I'm going in for the hug. Yeah. So, I mean, I just empathize with people who have existing coping mechanisms from like the stressors that existed in life before COVID, that now is the perfect time to try to take on the quitting mechanisms with, you know, whatever it might be, but also recognizing that you know, that it's really hard. This is a highly unusual, high stress time. Yeah. And it is a temporary time. You know, we were talking this morning too on the team about like whatever bizarre coping mechanism you're doing. Somebody, you know, on our team was like, you know, I ate like a whole bag of Oreos already. And it's like, and I never would have normally done that. And it's like, well, that's okay. You know, I think we have to be gentle with ourselves right now. I think it's really easy to have very dark, negative self-thoughts, you know, and negative self-talk. Yeah. And we have to be gentle and go, look, this is temporary. I'm not like a permanently different person because of this. I'm doing the best I can with what I have. And then
so hard because people are losing jobs. There's all the economic stress. There's so much stress on so many
levels. Yeah. Which also, and I do want to say this because I was one that, you know, read the ASRM, you know, guideline. And I was a little like, oh, why couldn't they have taken longer time with like that language? It's just like the language, you know? Yeah. And And I look, I love ASRM, and I've been advocating alongside ASRM for the 12 years that I've been in this field.
Yeah.
Massive amount of respect for the organization and for the people who serve in the organization. I will say, stress is so hard on a pregnancy. And this is such an unusually highly stressful time. And so as a patient advocate, I advocate for self-care right now. I advocate for getting ready to have the best uterine environment for a fetus to grow, knowing that the impact of stress on a fetus is worse than it is on you. Because your immune system's already built, your system's already built, you have coping mechanisms, you have brain integration, right? As an adult, human, healthy person. But a fetus doesn't. And as it's developing, I think that's the thing that I'm just encouraging is I wish that embryo freezing was a little bit more available, than it is, because we need all those vents, for COVID patients. I do wish that embryo freezing was available right now.
Yeah, that's the hard part. And I hope, at some point we could start doing some more egg and embryo freezing soon, so that we could the biological clock.
Exactly.
Even if we don't yet feel like we can get pregnant yet. But I do want people to know that I really don't think it's going to take as long as, the year and a half to develop a vaccine. I think we are going to emerge into a new, COVID-19 normal, where we have hopefully more PPE, more personal protective gear, and we have better testing and those things. Right. It does seem like there's progress being made every single day. Like I heard
like that.
I heard on CNN just yesterday that they just approved from the Bill Gates Foundation some sort of self-test technology, which would be huge. Like if you could just get a kit mailed to your house and test at home.
Of course. Yes.
But then everybody gets tested, then you're positive, you stay home for 2 weeks. But then when you're negative, you go out. Like then the power of knowledge is going to be such a huge thing to fighting this.
I agree with that. One thing that I hope that comes out of it too, which is a little bit off topic for our typical shows, Serena, is that, I have long since said about corporate America, this one thing that I've always really, really been kind of against, and it angers me, is when people show up at work with cold and flu symptoms.
Yeah.
But somehow they think they have to be the martyr. But this is corporate America has put this on us.
Yeah, you're right. Martyr. But in the United States, they do this in the United States, not really in other countries.
I agree. They don't do it in other countries. It is
we're the country that doesn't take all our vacation time. We have an issue.
Right. We don't. We don't even have enough vacation time. We don't even take the measly 2 weeks.
Yeah.
And I do hope that what comes out of this is that corporate America wakes up and says, I don't care if you've got the sniffles, if you tell me it's allergies, if it's the flu, we've proven that we can still work from home. Yeah. And therefore, if anyone has a symptom of anything, I hope that corporations switch culture, that they pivot and they go, no, stay at home.
Yeah.
Because if we practice just even a little bit of this during regular flu season, we would have far fewer deaths from the flu than we currently do.
Absolutely. I also think it would give us a tremendous amount more access and progress in terms of how we treat people with disabilities, giving disabilities a lot more opportunities and a lot more access. Yeah. And I was talking with one of the fellows today about, maybe some of the barriers that people face, maybe part of the reason why there's so many infertility patients who never see a doctor. Maybe we can break down that barrier too.
Yeah, agreed.
Logging onto your computer is a lot less intimidating than
showing up,
going to the hospital and thinking somebody's going to be poking and prodding you and taking your. But you can meet the doctor first and develop a relationship and feel comfortable and get your questions answered before you ever have to walk in the door. And maybe that's going to make a big difference.
I hope that's our post-COVID norm. I hope that is.
I agree.
Industry-wide. I hope that this is permanent infrastructure in the field of infertility and the field of proactive family planning. Because I at FertilityAnswers, we like to really be inclusive
Yeah,
and
for everything. Yeah, for family planning, for fertility, for infertility, for general health.
Anything. If you're going to have a knee replacement surgery, I hope that you have a couple of consults over the phone first to get familiar with someone and get some of those questions answered.
Yeah.
Absolutely. That also is a shift, though, in the culture of our field, because I do think that we've long since been so focused on the cycle. Am I doing a cycle? Am I getting a cycle? Cycle's bringing a lot of cash.
Yes.
So there does have to be a shift back to an REI is a specialist, and an REI needs to be comfortable doing specialty consults that may never end up in an IVF cycle.
But we overcame a huge barrier now that CMS on an emergent basis said, okay, now we actually will pay for telehealth. And why haven't we paid for telehealth before? So many other professionals get paid for the knowledge in their head. A lot of our training and our value is what's up here and how we help our patients. And lawyers are billing for their advice. Doctors should be able to do the same thing.
Absolutely. So I think, when Serena and I were preparing for this particular episode, we're like, what should we talk about? And I think that the key is that we talk about, sometimes there are still questions we don't have answers to. And if there's anything that COVID has taught us, it's that every single day a new question pops up, and it takes time to get to those answers. We don't have all of them, but for when it comes to decision making for our patient population, it's taking into consideration all these factors. And that if we're looking at a 4 to 8 week delay, if we're looking at this temporary pause, is being proactive during that time period, checking in on your timing, tracking the timing, cleaning up your diet. The markets have a lot of fresh produce because everybody went nuts on prepared food, stocking in prepared food. So we have tons of produce and fresh meats and fresh fish available all over this country. So really taking on your diet, really taking on education, taking on, talking to multiple different doctors in a billable telehealth environment, using your insurance for that purpose. And, choosing healthy habits if you have to give up, a bad habit like smoking, or certainly right now, as hard as it is for people who use pot medicinally for anxiety, don't smoke pot right now.
Yeah.
If you want to conceive, do not smoke pot.
And also I worry about anything going into your lungs.
Anything, don't vape. Oh, I had a friend told me vaping. I was like, please don't vape. Vaping. Yeah, it's nothing with the lungs.
You got to keep your lungs as healthy as they can be right now. We're just worried about this virus.
Yeah, exactly. So hang in there on the Monday Motivation. Hang in there. We will get back to family building, even with unassisted. Just be mindful.
It's not going to be forever. It's not. It's not. So, stay safe.
And have to have the faith that if you skip a month or two of trying, don't stop the trying part, the fun part. If you're going about this unassisted, but be mindful of when you're ovulating and be safe, so that if you do have a pregnancy complication like an ectopic or something else, again, not fear mongering, just weighing the risks with how tasked the hospital systems are. Just be careful, be safe, keep washing those hands. We will get to the other side of this. The world will look a little bit different. It'll work a little bit differently, but I think it's going to work for the better. I think so. I really do. All right, everybody. We'll see you next week for Monday Motivation. Thanks for joining us. Thanks, Serena.
Bye.
Bye.